Greeting to everybody. Today we are back with our topics, Abruption Pacenta as one of the major causes of antepartum hemorrhage. This is O2 healthcare consult by Dr. Okelo Bosco II, a specialized obstetrician and gynecologist. We should be able to define what is placenta abruptio. We should be able to also to explain the risk factors, presentation, diagnosis, complication of abruptio placenta. By definition, abruptio placenta is defined as placental separation from a normally implanted placenta before delivery of the fetus. It affects about, the incidence is about 0.3 to 2% of all pregnancies. And abruptio placenta is more common than placenta previa. So in our clinical practice, we shall be meeting more of abruptio placenta than placenta previa. As you can see from our diagram, you will be able to see these two diagrams showing you where the separation is, and typically it's there. Yes, etiology, risk factors of abruptio placentas, unknown causes. However, we identify defective trophoblastic invasion of the endometrium, which makes placenta not firmly adhered to the walls, but the cause is really unknown. Risk factors of abruptio placenta, we have maternal risk factors, then obstetric causes, maternal causes or maternal risk factor, obstetric risk factors, then others. We have previous history of abruptio placentas is almost common in 10%. We have advanced maternal age, multiparity, hypertensive women or hypertensive disorder in pregnancy, low body mass index. We have also smoking and those who misuse what? Our drug abuse. In obstetric risk factors, we have intrauterine fetal growth restrictions, we can have polyhydramnios, we can have preeclampsia, we can have non-vertex presentations, we can have intrauterine infection, we can also have premature rupture of membrane, and others can be abdominal traumas. These are the different risk factors of the abruptio placenta. We are going to look at the type of placental abruption. There are several different types of placental abruption depending on the degree of the separation as one of the, you can name the type like that. Number two, it can depend on the presence or absence of vaginal bleeding. Number three is the site of the bleeding. When we decide to use the type, depending on the type of what, the degree of separation, we can have partial placental abruption. This does not mean the placenta does not what? Does not detach completely from the uterine wall. We shall also have incomplete or total separation where the placenta completely separated from the uterine wall. Marginal abruptio, this is a situation where there is small detachment from the walls, and the prognosis in the marginal placenta abruption is very good. And in our diagram down there, you should be able to see all these diagrams very well. So we go to the second type of placenta abruption based on the presence or absence of vaginal bleeding. We have revealed placenta abruption. This is a situation where there is vaginal bleeding. We have concealed abruptio placenta. This is a situation where there is no vaginal bleeding. From our two diagrams there, you should be saying the one which is revealed is seen clearly there, where the bleeding is coming from the vagina. The other one which is concealed can be seen clearly, there is no bleeding coming from the vagina. abruption placenta abruption type is based on the site of the bleeding. So if the bleeding is subchorionic abruption, the bleeding is between the myometrium and the placenta membrane. So we have retroplacental abruption, the bleedings between the myometrium and the placenta. Then we pre-placental abruption, the bleeding is between placenta and amniotic fluid. Then we have intraplacental bleeding. This is bleeding within the placenta. The placenta abruption type called subchorionic versus retroplacental, pre-placental, and intraplacental definition, and their meaning has been explained above. Those are the different types you can be well to. But the most common use is depending on the vaginal bleeding, where we are talking about placenta is either concealed abrupto placenta or revealed abrupto placenta. That is commonly used in clinical practice. We are going to look at the grading of the placenta previa. It's very necessary because this grading also will determine the outcome and the severity. So grade 0 is what we call asymptomatic. These are small retroplacental clot less than 1/50, and normally the diagnosis is just made when the patient has just come for maybe ultrasound, then the ultrasonographer will get hit. We have grade 1, which is mild. There is vaginal bleeding, and there is between 150 to 500 mils of bleeding, vaginal bleeding between 150 to 500 mils. There is uterine tetany, and there is tenderness. May present with no sign of maternal shock or fetal distress. In grade 2, we call it moderate, vaginal bleeding, no sign of maternal shock, but there is what? Sign of fetal distress. In grade 3, which we call it severe, there is vaginal bleeding, and there is what marked uterine tetany, abdominal pain with maternal shock, and there is also fetal demise. The fetus has already died, and coagulopathy may present in 30% of the cases. How do this patient clinical presentation abruptio placenta? Symptom, pain and vaginal bleeding is the most important symptom that will always exhibit. With decrease, the mother will report decrease in fetal movement. The sign that the mother may be in shock or abdominal tenderness, always described as what? Woody heart. And there is fetal heart is always difficult to get. Diagnosis of placenta abruptio, 1 is by clinical diagnosis, 2 is by ultrasound diagnosis. A pregnant woman, 28 weeks, with vaginal bleeding, severe abdominal pain, always give you suspect of abruptio placenta. When you go for ultrasound, the ultrasound will be able to demonstrate there is retroplacental hematomas that confirm the diagnosis. Laboratory studies in abruptio placenta. What lab investigation do we do? Number 1, we need to ask for complete blood count, CBC. This may reveal anemia as a result of bleeding and may present with thrombocytopenia, low platelet as a result of complication. Pyrovenous levels is even mildly decreased. Pyrovenous, this may represent significant coagulopathy disorder, and our aim is always to keep it above 100 grams per deciliter. Prothrombin time, partial thromboplasmin time, all these improve. If you ask for them, if they are already abnormal, it is so there is what? When you are doing abnormal, it may be needed to do cesarean section in a live baby in abruptio placenta. Urea and creatinine, hypovolemia and organ ischemia may lead to dysfunction. So kidney would be affected, so it's good to do kidney function, renal function test. Klehuber-Beckett test detect the fetal red blood cells in the maternal circulation, and this is necessary for rhesus negative mothers, because if there is isomonization occur in a woman who is rhesus negative, then she might require anti-D. Blood groups is necessary. Booking blood is also necessary. Complication of abruption placenta. The calaverous uterus has been described by a French gynecologist. During abruption placenta, there is massive movement of blood into myometrium of the uterus. When they enter there, they get clotted there. So the color of the affected area will turn bluish or greenish. And this, after delivery, they fail to contract, is the cause of what? Postpartum hemorrhage. Postpartum hemorrhage, I've already explained how the calaverous uterus is, as described by the French gynecologist. We know postpartum hemorrhage, excessive vaginal bleeding more than 500 ml after vaginal delivery, or more than 1,000 ml after cesarean section. Intrauterine fetal death is common. Then we also have disseminated intravascular coagulopathy as a complication, then maternal hypovolemia, and roughly maternal death. We are also looking DIC in placental abruption. The placenta abruption can lead to severe coagulopathy and fetal demise. The first, the SUDA is very rich in thromboplasmin. As the SUDA degenerate in the and releases thromboplasmin and thromboplasmin-like factors into the circulation, this leads to intravascular coagulation. As a result, the systemic consumption of the clotting factor, including the platelet, causes abnormal blood clot, interfere with clotting systems. Therefore, the presence of small clot plug and in the small vessel will lead to organs ischemia and failure as a result of the blockage. That is to say about placenta abruptio.